Fainting is a common condition in which individuals, often without much warning, just simply collapse. They typically will have some sensation that their vision is going, and then their body loses power, if you will, and frequently they'll find themselves on the floor. The first episode is often so stunning and unexpected that the individual has no sense that anything is wrong. Later on, however, very often patients can be taught to identify warning symptoms and thereby protect themselves from falling down and hurting themselves. All fainting spells really come about because the blood pressure in the brain falls, and that can be due to a heart rhythm disturbance or some vascular disturbance. And when the blood pressure in the brain falls, then the eyes don't work and the hearing doesn't work and the muscular control systems don't work, so the individual collapses. Almost all of these are cardiovascular in origin. The most common cause of faints, though, in all age groups, covering about 60 to 70% of all faints, is what we call vasovagal, or the common faint. In the movies, it used to be thought of as the swoon. And these people basically have a reflex in their body, which we all have, but some people it's just more active than in others. And that reflex causes a drop in their blood pressure, which then causes inadequate brain function temporarily. In those cases, treatment is to try to prevent the reflex from triggering, sometimes using medicines, sometimes just with other exercise techniques, or in some cases we just treat them with increasing the amount of salt in their diet. It really depends on the individual. Many times we require all sorts of different treatments in people in order to really fully prevent these episodes. Well, mostly individuals who faint only faint once or twice in a lifetime. All of us have the necessary reflexes to have vasovagal or common faints, and then as we get older we may develop the diseases that are associated with more severe forms of heart-related faints. So if an individual is young, otherwise healthy, and just has one faint or maybe two over the course of a decade, I don't think that's an issue and they shouldn't be concerned. There are some special types of diseases that occasionally strike young people. So if their doctor checks their electrocardiogram on the first episode and sees no real problem and listens to the heart and hears no real problem, I think those people, once every few years having a faint is not a big issue, as long as they're safe. In other words, they don't hurt themselves or they don't end up lying in the middle of the street. On the other hand, if somebody has known heart disease, so they've had a heart attack in the past, or they have a strong family history of heart disease, and they're more in the middle age and older age group, those people should seek attention for a faint right away. It may turn out to be an innocent faint, in which case reassurance can be provided. But in the setting of heart disease, faints can also be due to more serious problems that need attention. If a person faints, the first thing that should happen is that they remain flat on the ground. So usually they're not responsive, usually for a minute or so, but their breathing, while slow, might still be quite adequate to support their needs. The individuals who see the faint, the bystanders, first thing they should do is check to make sure the patient is breathing. They probably won't feel much of a pulse because the blood pressure gets so low, but they should not raise the patient up. If we think about the way the body is constructed, the brain is in the most gravitationally disadvantageous place. It's sitting at the top of the structure. And if blood pressure falls, the first place that is going to be affected is the top of the structure, the brain. Gravity, when the patient is now fallen to the ground, equalizes all that. So we should let the patient, as long as they're in a safe place and as long as they're breathing, let them recover. Generally speaking, the pulse will return within 30 seconds to a minute and a half. So as long as that's happening, that's fine. We should let the patient lie there probably for 5 or 10 minutes or even longer to make sure that they're stable. Maybe raise their feet a bit to get some more blood into the circulation. If the bystander, however, is concerned that this may be a more serious problem, they should never fear about calling 911. But after several faints, especially family members are accustomed to seeing an individual faint, they know that if you just let the individual lie in a safe place with their feet a little bit elevated, they'll come to and then recover promptly thereafter. The University of Minnesota has had a syncope center for more than a decade. Syncope centers are basically centers that are designed to try to identify the causes of collapse in people and to make sure those individuals get to the proper type of treatment. So occasionally we'll identify an individual who has to have a pacemaker and they'll get a pacemaker. We'll identify individuals who may need a defibrillator, and that will happen. Many of our patients, though, have innocent faints, and we can reassure them. From time to time, we suspect that maybe it wasn't a faint at all and that it was a seizure, in which case we work very closely with the neurology department to make sure those patients get the right attention. Conversely, the neurologists have been working very much with us, sending us patients where they think that perhaps it was a faint and not a seizure. So it's a collaborative organization at the university, particularly cardiology and neurology, with some input from cardiovascular surgery, that makes this a place where we've specialized in the evaluation and treatment of patients who have had, we think, faints and collapses.